Let's talk more about the issue now. Being joined at the news at 10 live from our studios in Abuja by the Director General of NACA, Dr. Sani Aliyu. You're welcome to the news at 10. Well, the rise in HIV infection rates in Nigeria, according to the UN report, is quite disturbing, wouldn't you say?
Well, I wouldn't call it a rise. Remember, the numbers have been much higher than before. If you look at the prevalence of HIV back in the early 2001, we were talking about well over 5% of the sexually active population having HIV. What the UN report actually said was that we have 220,000 Nigerians acquiring the HIV virus every year. That's on average about 600 a day. That's considerably less than what it was some years back. In terms of the number of people on treatment as well, 10 years ago we had only 130-something thousand Nigerians on treatment. We've just crossed the 1 million mark. And that's a major achievement for any country. South Africa is the only country that has 4 million people on treatment. So looking at the size of our epidemic, I wouldn't say we are there yet. It's certainly not Uhuru. No, we still have a lot of work to do because we still have about 2 million Nigerians that need to go on treatment. But we're making progress, and it's slow but steady, and we intend to get there.
What are the factors that have contributed to the rise in the numbers?
So again, I would say, well, I wouldn't call it a rise in the numbers. I would say what's contributing to the new infections. And what's contributing to the new infections is a multiplicity really of factors. What we have are predominantly young girls between the ages of 15 to 24 contributing to a large number of the new infections occurring. We also have what we call key populations, the most at-risk population, possibly contributing up to 45% of all new infections. And we know over time that awareness as far as HIV is concerned has been waning generally in the community and society in general, partly because people have fortunately stopped dying from HIV. With the provision of antiretrovirals and more people coming on treatment, there are fewer people living with HIV that are dying. People are still dying, but what I'm trying to say is not in the sort of numbers that we had a decade or more ago. So yes, there is a need for us to look at our prevention strategies. But one of the reasons why we're concentrating on treatment as well is because with more people coming on treatment and becoming virologically suppressed, the less the likelihood of transmission. So overall, by putting people on treatment, you're not only dealing with the individual, but you're also helping the public health aspect as well.
Have we identified the parts of the country where these new infections are being observed?
So Nigeria has a mixed, what we call a mixed epidemic with a very wide geographical variation. At the moment, we have about 9 states that have a need of at least 75,000 people living with HIV requiring to go on to treatment. But at the same time, we have about 9 states that have more than 50% of the people living with HIV on treatment. So some states are doing better than others. Right from the beginning of the epidemic, we know that there are parts of the country that have relatively higher prevalence than others, and this is due a variety of factors, including awareness, education levels, issues with culture, etc. But that doesn't necessarily mean that we should change our focus. I think every person living with HIV needs to go on treatment. People need to be aware of their status regardless of whichever part of the country they are in, because every part of the country would have somebody living with HIV that needs access to treatment.
You did mention during the conference in Abuja the poor access to antiretroviral drugs. Could you tell us more about that?
So what we are concerned about is not really necessarily poor access, but the need to ramp up treatment and where these resources will need to come from. We have 1 million Nigerians on treatment, but we estimate we need to have 2 million more to go on treatment if we're really going to achieve epidemic control. It costs about 50,000 naira per patient per year to keep somebody on treatment. At the moment, out of the 1,050,000 on treatment, 60,000 are paid for by the federal government through the Taraba and Abia program, which is, so we've got 2 states. And then the remaining 1 million plus are paid for by external donors. Essentially, that means that 95% of those million plus Nigerians on treatment are being treated courtesy of a foreign government. And that clearly creates a situation where you have a program that is not sustainable, because that sort of arrangement cannot continue for another 5-10 years. And therefore, we need to identify those additional source of funds to not only put those 2 million people that need to go on treatment, but to also keep the 3 million in total on treatment until the end of their lives, because they need that treatment. We talk about a right to health, which is the main World AIDS Day theme for this year. And for people living with HIV, that right to health equates to right to treatment, because it's the access to the drugs, the antiretrovirals, that will keep them healthy and will give them a good life. So, yeah, so it's a multi-tiered approach, certainly. But we have to work with the state governments, the private sector, health insurance, and find innovative ways of financing the program.
I appreciate your being here tonight. Dr. Sani Aliyu, thank you for joining us on the News at 10. In part 2, after the break, early morning fire raises over 1,000 shops in a building materials market in Kaduna State. Please stay with us.